you have to remember none of these data sets were generated for those purposes, right?
Yeah, I think that healthcare too as an industry, and having worked in tech for more than 30 years and with a variety of industries, I've seen sometimes the data is the data and it comes from a source system and it can be mined and analyzed and interpreted. But to me, healthcare data seems even more like it lacks context, that it needs to be combined with other sources to really get the context for kind of what it means and what actions we should all take on it. But in terms of the greater mission of healthcare and improving outcomes and improving access and reducing cost and reducing waste, it seems like data needs to come together and get that context to then really be able to ask those questions that need to be asked and answered.
But you have to remember none of these data sets were generated for those purposes, right? So a medical claim is what it is and is designed with the elements that it has so that people can get paid. And so there's lots of intricacies of how the providers and the payers are using that data element to communicate about the necessity of care and the reimbursement rates and making sure that things were handled according to the contract that they had worked out. Right? There might be elements in that claim that's specific to the purpose of it being billed that would maybe lead you astray. A quick example: the address that's listed on the claim in many situations is not exactly reflective of where the patient really was. It has more to do with, in some cases, limited circumstances, where to send the bill, or I'm sorry, where to send the payment.